Hello, welcome back to my channel. I'm happy that you're seeing my videos and I'm getting a lot of subscribers. Thank you all very much, whoever has subscribed. I hope my videos are of some use for you. Myself, Dr. Rocha, as you all know, with psychiatric nursing specialty. Well, do please subscribe if you're seeing this video for the first time and do share it to the others. Let's move on to the topic straight away. Today we are going to deal about neurotic disorders, and we have so many conditions under neurotic disorders. So under neurotic disorders we are going to see mainly today about overview of neurotic conditions, their classifications, and under classifications we have one condition called as phobias, and today we are going to just go through phobias in detail. If you are all ready, shall we go ahead? Okay. Coming to neurotic conditions, we are going to see about introduction, ICD classification, as I have said, origin, definition of neurosis, and we have different types of anxiety disorders like phobic anxiety, generalized anxiety, panic attack, OCDs. And under this today we are going to see about phobic disorders. Before that, let's just have a overview of what are neurotic disorders. Neurotic disorder is a less severe form of psychiatric disorder. Now, we in our previous videos have seen about psychotic disorders. Under psychotic disorders, we have seen about schizophrenia, which comes under functional psychosis, and the next one, affective psychosis. So, under that, we have seen mania and depression. We have major part of this mental disorders usually are covered under psychotic conditions and neurotic conditions. When we compare neurotic disorders with the psychotic disorders, neurotic disorders are considered as less severe form of psychiatric disorders. Why? Because there is a stress which is accompanying with this disorder. So automatically when we remove the stress, the condition will subside. So that's the reason these neurotic disorders are called as less severe form. When we say neuron, nervousness, anxiety, stress, these are some core contents of these neurotic disorders. So here patients show either prolonged emotional reactions to any given stress, and these disorders are not caused by any organic disease of brain, and they do not have hallucinations and delusions. That's the thing. That's the reason they are considered as less severe form. Coming to ICD classification of neurotic, stress related and somatoform disorders, they come under chapter F40 to 48. 40 we have phobic anxiety disorders, 41 other anxiety disorders, 42 OCD, obsessive compulsive disorder, 43 reaction to severe stress and adjustment disorders. Then 44 we have dissociative disorders, which can be addressed as conversion disorders. 45 we have somatoform disorders, and 48 we have other neurotic disorders. Please remember this classification because I am going to make multiple videos, separate videos under these neurotic conditions. Coming to classification of neurosis, said anxiety disorders, phobias, OCDs, dissociative, somatoform disorders, and we have hypochondriasis and PTSD. Coming to origin of these neurotic disorder. As I have mentioned, this word neurosis is derived from two Greek words. Neuron means nerve with a suffix, and osis means a disease, an abnormal condition. So neurosis means an abnormal condition or when nerves are diseased. So it is a nerve disorder, and this is coined in 18th century by William Cullen. He is a Scottish physician. So he brought about this concept that whatever nervous disorders we are having without an organic cause, we call them as neurosis. Later on, Sigmund Freud, he termed this neurosis as anxiety neurosis because in all neurotic conditions, anxiety is the core feature which is present. Now, before we could proceed, as I have mentioned, we have dealt about psychotic conditions, psychosis and neurosis. What is the difference between psychosis and neurosis? So under three subcategories like specifications, psychosis and neurosis, we can see genetic factors. For psychosis, it is more important because we said monozygotic twins and inherent parents, close relatives. So psychosis has more importance when compared to that of neurosis. Why? Because in neurosis we said there is a stressor which is present. So less importance. Coming to stressful events, which are more when compared to that of neurosis, means stressful events are more, which led about to psychosis. In neurosis also, stress is faced. There is a cause, but when compared to that of psychosis, the stressors are more prevalent in psychotic conditions. Next, coming to behavior. Behavior is severely affected. Is that delusions are present, hallucinations are present, flight of ideas, speech, mood is also affected. So, and in neurotic conditions, not that much. Thinking and perception is disturbed, and the neurosis is not disturbed. Judgment is impaired in psychotic conditions, where judgment is present in neurotic conditions. Insight is being aware of what they are suffering with is called as insight. Having awareness and understanding that they are suffering with a particular condition, that is called as having insight. So insight is lost in psychosis and insight is present in neurosis. Coming to drugs. So for psychotic conditions, we treat them with antipsychotics. Antipsychotic drugs are also otherwise called as neuroleptics or major tranquilizers. To treat neurosis, we treat them with minor tranquilizers like benzodiazepines. We could categorize them as benzodiazepines. Coming to ECT, for psychosis, it's not very useful unless psychotic condition present with any moods like mania or depression. For neurotic conditions, ECTs are not needed. Coming to prognosis, for psychosis it is bad, and neurosis we said when the stress, when we find what is causing anxiety in them and when we try to remove, prognosis is good for them. I hope usually we get a question for 5 marks asking us to differentiate between psychosis and neurosis. So you can use these points to write the answer. Now, we said we are going to discuss regarding phobias, but the core feature is anxiety. So we need to understand what is anxiety. Anxiety is a normal phenomena which is characterized by a state of apprehension or uneasiness. A state of apprehension or uneasiness arising out of anticipation of danger. Whenever a person perceives that he is in some danger, he will develop uneasiness. We notice this. Heart rate will increase, uh, palpitations, sweating, plus confusion, tension, one sort of tension. That we call it as a state of apprehension or uneasiness arising out of anticipation of danger. That means imagination. We forethink that we are in some danger. So as a result, anxiety is produced in that person. So anxiety disorders are abnormal states in which most striking features are mental and physical symptoms of anxiety which are not caused by organic brain disorders or any other psychiatric disorders. So under anxiety disorders we have phobic anxiety disorder, panic anxiety disorder and generalized anxiety disorder. So today for our session we are going to discuss mainly regarding phobias. What is meant by phobia? Fear. Most of us have an understanding that phobia means fear. But when you go in depth, phobia is defined as irrational fear. It is defined as what? Irrational fear or unreasonable fear towards specific object, activity or situation. Now, how can we address this term irrational or unreasonable? Suppose, for example, the fear which is portrayed outside is disproportionate to the stimulus. I hope you are getting. I am using something in the environment is causing fear in us, that is called as stimulus. Let us take stimulus is causing fear in us, and the fear which we are having is disproportionate. Disproportionate. That's the reason we are using this word irrational. Maybe, for example, if you take, you are having fear towards cockroach. So cockroach is an insect which is not lethal or it does not harm a person, but still we get scared. We have lot of fear towards cockroach. By seeing cockroach we try to run out of that room, and if we are somewhere near to it we try to jump out, sweating and all this. So the amount of reaction is disproportionate. That's why we use this term irrational fear and unreasonable fear. So whenever we are exposed to that stimulus or a specific object or a situation, wherever we are, lot of anxiety is produced. So phobic anxiety disorder. Coming to types of phobias, we have simple phobia, social phobia and agoraphobia. So what is meant by simple phobia? It is an irrational fear towards specific object or a stimulus, or even that is called as simple phobias. Simple phobias are common during childhood. Maybe having fear of snakes, fear of darkness, fear of insects. By the time we reach our early teenage or adolescence, usually these fears are lost. But some among these fears are carried out to the adult life. Such ones we call them as what? simple phobia or specific phobia. So phobia related to an object or a stimulus or an event or anything. Signs and symptoms of simple or specific phobia. Irrational and persistent fear. When we use this word persistent, as long as the stimulus is in front of us, irrational fear is present. Immediate anxiety when coming in contact with the feared object. Loss of control, fainting, or panic response. Worry with anticipatory anxiety. Anticipatory, maybe when we say anticipatory, imagining, we are not actually facing the stimulus, but imagining that we are going to face that stimulus might cause a lot of anxiety. As a result of this, the person will have impaired social as well as work functioning, as well as avoidance of activity involving feared stimulus. So, for example, we have different types of phobias, just we'll see. For example, gamophobia, fear of marriage, fear of having commitments and relationships. Then AIDS phobia, fear of AIDS, insectophobia, fear of different types of insects. Hematophobia, fear of blood. And claustrophobia, fear of closed places. Fear of heights, we call it as acrophobia. Zoophobia, there are so many phobias. You can just go in detail, browse, just different types of phobias you will get. Fear of heights is called as acrophobia. We are just listing some of the examples of specific phobias. Coming to social phobia. So it's very simple. Social phobia, most of us do have when we are placed in such a situation where we have to present ourselves in front of a group or a congregation and address to them. Definitely we'll have what? Shivering, tremors, yeah, sweating, and shaking of voice. So if we are having these fears, definitely we won't be able to perform well in front of the audience. So this is called as social phobia, irrational fear of performing activities in presence of other people or interacting with others. As a result of this social phobia, our social interactions will be very poor. So patient is afraid of his own actions. He is very sensitive to criticism. He feels very embarrassed when someone comments. Fear of humiliation. With all these thoughts, the person may develop social phobia. Next one, signs and symptoms we have like hyperventilation, sweating, cold and clammy hands, palpitations, confusion, gastrointestinal symptoms, trembling of voice and hands, as I have mentioned. Next, coming to agoraphobia. It is characterized by irrational fear of being away from home. Familiar settings. Being places away from familiar settings of home, especially in crowds or situations where patient cannot leave easily. So you can imagine where large crowds gather during festivals and we get jammed between them and we cannot escape from such a situation. Suppose during our childhood, um, if we have experienced like that or lost in some festivals where large crowds gather, maybe chances of developing agoraphobia. So fear overriding the fear of open or public places when accompanied. So they will develop panic disorder. Having when they are in public, gathered or surrounded by large group of persons, we know when we do for some festivals, we do gather where there are large crowds. Coming to etiology of phobic anxiety disorder, I think you're by this time you got acquainted with what are different types of phobias. Is it simple or a specific phobia, social phobia, and agoraphobia? Coming to etiology of phobic anxiety disorders, we have psychodynamic theory. Whenever we say psychodynamic theory or psychoanalytic theory, we need to remember Sigmund Freud. So, according to Sigmund Freud, whenever a person is having phobia or whenever he has any anxiety, he uses different types of defense mechanisms that protects a person from unwanted ideas or fearful stimulus. So what type of defense mechanisms person uses? First one is suppression. Suppression means there is, and repression. Okay, suppression, repression. Suppression means consciously person puts in an effort to suppress the impulses or fear, whatever it is. When you get angry, you try to count 1 2 3. You know, you're aware that you're having anger and you want and you willingly try to suppress it. The same way, when we are exposed to any fearful stimulus, we want to control ourselves. Like we say, oh no, I'm not going to react to it. I'll try to control myself. That's what it is. So we use this defense mechanism. Next, repression. Unconsciously denying the impulses. So it's not wantedly done. We will try to repress whatever anxiety which is created in us and try to put up a false front. Next, another one is displacement. Showing that whatever is causing anxiety in us, those feelings onto another person. That is called as displacement. Showing when negative feelings are displaced onto another person, usually less threatening, then it is called as displacement. Now, according to learning theory, we have classical conditioning and operant conditioning is also there. According to classical conditioning, which is given by Ivan Pavlov. So, here a stressful stimulus produces an unconditioned response. The harmless object alone produces the fear. Now, if you just look down, and it's a natural behavior, when an injury is caused, it is not expected, unconditioned stimulus, suddenly it has occurred in us, it happened to us, unconditioned response is created, that is pain. So, first time when you encounter an injury, you experience pain. That is unconditioned stimulus and unconditioned response. Now, from this incident, we learn and we try to react a learned behavior. So, injury, whatever has occurred, it remains in our memory. Next time when an injury occurs, you attach pain. Whenever injury occurs, you know that memory of injury. You know, okay, if I get hurt, it will be a lot painful. So the memory of injury is conditioned stimulus. It will produce anxiety and stress. So pain is the conditioned response. That's how it is. We tend to react. Maybe these phobias do develop like during our childhood. Our grandparents might have been telling stories, or we would have heard stories about devils, where our uncles and aunts and someone telling us stories about devils. It was night time and person was walking on top of the tree. You see a white figure and it is a devil, like that. So imagine that night is like you imagine night. It is something danger. which is not pleasant. That's how you form memories. So unconditioned stimuluses do create conditioned responses. Next, coming to cognitive theory, anxiety is as a result of faulty cognition. The way you perceive, the way you imagine. So when we say cognitive, it is mainly related to the thought pattern. For example, if you just lie down on a bed, and if you fall asleep, just imagining, I may put my hand down, and when I put my hand down, maybe some snake or something under the bed will come and just catch my hand when I sleep. Oh, what will I do? Or maybe devil is going to come and pull me under that bed. These types of imaginations which are irrational and they are negative imaginations, and this will cause lot of anxiety in us, phobia in us. Next, coming to the cause most commonly seen in women and onset, second and early third, that means between 20 to 30 years. Next, onset is without the cause and it may be chronic. We said some of them by the adolescent age they may fade off, but some are carried, and spontaneous remitting sometimes. Coming to diagnosis, there is no specific diagnostic test as such, but according to ICD-10 criteria we can classify the condition, and definitely these phobias will have anxiety. Coming to treatment, pharmacotherapy, we have benzodiazepines, antidepressants and beta blockers. Now, benzodiazepines are also otherwise we said mild tranquilizers, hypnotics or sedatives. You can call it as like diazepam, clonazepam, oxazepam, lorazepam, alprazolam. All these drugs are usually prescribed to reduce anxiety in the person, and they act as a hypnotics also. Next, coming to antidepressants. If any depression is present in them, we have different types of antidepressant drugs like TCAs, SSRIs, GABA inhibitors, MAO inhibitors, which will be prescribed according to the condition of the client. Then we have beta blockers. Beta blockers, usually we hear this word when it is related to hypertensions. So like atenolol, then metoprolol, propranolol, timolol. All these drugs are beta blockers which reduce the tachycardia and anxiety which is created in a person. Next, coming to behavioral therapy, because the behavior is abnormal, uncontrolled due to the fear, extreme fear what they have. Definitely they will have hyperventilation at times. So behavioral therapy is needed. We focus on flooding, systematic desensitization, exposure and response prevention, and relaxation techniques. We will just see what they are in detail. Coming to flooding, it is an extreme form of behavior therapy where a person is directly exposed to the feared object. For example, I'm having fear of cockroaches. So in flooding, what they do is take a person into the room and open a box with a lot of cockroaches, and I am left inside that room for some time. We definitely know that cockroaches are not going to eat us up. So the person inside the room initially will have a lot of anxiety, might shout and all, but after some time the person might get used to just staying with cockroaches around him or her. So this type of behavioral therapy, we call it as flooding. So here also an example is phobia of dogs. Would be placed in a room with a dog and asked to stroke the dogs. just go near the dog. So that's how flooding is done. Next, coming to cognitive therapy. Therapy is used to break the anxiety patterns. Maybe asking the person to imagine himself, that he is somewhere like near a seashore, and after that let him imagine that a small cockroach is approaching him, and it is very harmless, and it's somewhere distant. And at the same time, when an anxiety is observed in that person, maybe he might be asked to relax himself. So there are some things like thought stopping we can do, where a person is asked to imagine and stop the thought, disconnect the thought. And before that, I would like to explain regarding systematic desensitization, which is very important. It will be asked for 5 marks question. So, in this systematic desensitization, here what the person does is he will ask the patient to list down all the phobic triggers or stimuluses, and keeping them aside, the person will be taught about different relaxation techniques, how to relax himself, meditation. And after teaching them different types of relaxation techniques, the phobic triggers or stimuluses are arranged in a hierarchical manner. What is the most feared one? What is the least feared stimulus? So, after this, the person, after arranging that in a hierarchical order, here the therapist will ask the person to either close his eyes and visually imagine, and next, when the person lands up into anxiety, maybe he will be asked to use the relaxation techniques, or maybe the person can be directly exposed to the stimulus from a distant area. It is brought near to the person, and as the person develops anxiety, he will be asked to use the relaxation techniques and meditate. So systematic desensitization, it follows a pattern of steps. Next, another one is exposure and response prevention. So here the person is exposed to the feared object or a situation, and response is prevented by using the alternative diversional methods and relaxation methods. So relaxation techniques plays a vital important role in controlling all anxiety disorders, that we have to keep in mind. Next, coming to supportive psychotherapies, we can provide group therapy, individual therapy, music, dance therapy, talking therapies. As per the condition of the person, we can use these various different types of psychotherapies. Coming to nursing management, we are not going to go in detail regarding nursing management as such, but we will highlight the two main nursing diagnoses. Assessment parameters focus on physical symptoms. Physical symptoms, when we say heart rate, tremors, cold and clammy, and we take the physical observations. Then we consider the precipitating factors. What factor is triggering? That is stimulus. Then avoidance behavior associated with phobia, how the person is avoiding. Then the impact of anxiety on the person's physical functioning, and whether the person is able to cope up with the situation, whether previously the person, if he has or she has encountered the stimulus, how did they cope up. So normal coping ability, and why now he is having a problem in coping, thought content, and as well as the social support systems who can aid the person to come out of this situation. All these factors are assessed. Basing upon the assessment, we will formulate a diagnosis. First one, fear related to specific stimulus, simple phobias, or causing embarrassment to self in front of others, evidenced by behavior directed towards avoidance of feared object or situation. So, fear towards specific object. What are the nursing interventions for this? You should assess and gain consent first. So, assess for what the patient is having this fear or anxiety, and ask the person what type of coping he had used before. Educate the person on using different types of relaxation techniques. Refer the person for any psychotherapy, for systematic desensitization. Ask the person to relax or stay calm, administration of medications. Encourage the person to verbalize on one-to-one basis. So explain to the person regarding the harmful nature of the feared object or an event. So ask the person to use diversional therapies or involve himself in recreational therapies to reduce the anxiety. Next, coming to social isolation related to fear of being in a place from which he is unable to escape, evidenced by staying alone, refusing to leave the home or room. So here you can see it is like the diagnosis mainly for agoraphobia. So here also you will assess the mental status of a person, and you try to dig into the roots, cause any incidences which has caused such a fear in this person. Improve the self-esteem of an individual. Encourage on interpersonal therapy. Refer the person to the psychologist so that he can have an interpersonal therapy where he can improve his social skills, build interactions, involve the person in group therapies, and provide positive reinforcement for the person. These are certain ways where you can implement some of these nursing interventions and where you will get a good outcome. Continuously assessment is needed so that patient condition improves. So far we have discussed regarding neurosis definition. Neurosis means nerve disease or nerve disorder where anxiety is very common. Under anxiety we have various conditions like generalized anxiety, panic anxiety, or phobic anxiety disorders, where we have discussed especially related to phobias. Under phobias we have three different types of phobias. We said a simple phobia or a specific phobia, then we have social phobia and agoraphobia. We have seen about the various etiological factors and different signs and symptoms under each categorization, then how to treat the person medically as well as using psychotherapies and nursing management of phobic anxiety disorders. Well, thank you all very much. We will end this video for now, and we are going to discuss in our later videos regarding other types of neurotic conditions. I hope this video is useful for you. If you do like these videos, please do subscribe and share to others, as they will be benefited if you share to others too. Let's meet again pretty soon. Thank you all very much. I shall end this video for now.